When you're hand washing, make sure you remove all jewelry from your hands and arms. Use soap and warm water and wash for at least 15 seconds. If you ever look when they're teaching preschoolers how to wash their hands, they teach them to sing a song like Sing the ABCs or Twinkle Twinkle Little Star, and keep washing their hands until they're finished. Scrub under and around fingernails with a brush. This comes into effect particularly when you are speaking with female providers who may have their fingernails grown out, particularly acrylics. Acrylics have been banned by certain accrediting bodies such as JCO. If you ever work in a JCO accredited facility, you cannot have acrylics because pathogens have been known to get trapped underneath those acrylic fingernails and have caused infections within those fingernails. Rinse your wrists, hands, and fingers with running water. Use a paper towel to dry them off. Use a paper towel to turn the faucet off, and avoid touching any part of the sink or door handle. According to the CDC, if hands are not visibly soiled, use alcohol-based hand rub for routinely decontaminating hands. This issue has come up time and time again. There's a lot of debate on whether or not hand sanitizers are appropriate. There are many infectious disease physicians who would argue that alcohol-based hand rubs and hand sanitizers have sabotaged clean techniques within healthcare in the United States. Ultimately, the best method is hand washing. When you get to the hospital, anything along those lines, hand washing is the absolute best method. You can see some sediment here, pathogens living in this petri dish. Let's see. PPE. This can vary text to text on the difference between PPE and BSI, which again, BSI is body substance isolation. For this particular text, they define PPE as eye protection, protective gloves, gowns, and masks. For the purpose of our class, I want you to be familiar with BSI covering these terms, and I'll write that up here for you. Okay, as I said, BSI, body substance isolation, is what I want you to recognize as these terms, this equipment: eye protection, protective gloves, gowns, and masks. Particularly when we're talking about eye protection, we're talking about eye protection from bloodborne pathogens. For protective gloves, we're talking about nitrile, vinyl gloves, gloves that, or latex gloves if your service uses them. Gloves that prevent from pathogen transmission. Gowns, again, prevention from pathogen transmission, and the same thing for masks. For PPE, what I want you to be familiar with for the term PPE is more concrete terms of protection. When I think of PPE, I consider a helmet, maybe goggles if I'm working an extrication site to make sure no glass or debris gets in my eyes. Turnout gear or thick covering coveralls, which are used for extrication and various rescues to help protect the provider while they are working with a patient. Again, this is a form of eye protection. If you look on the one on the right, this is actually a surgical mask with eye protection built in. This is a single-use disposable. The two on the left, the one on the right is the single-use disposable with the surgical mask built in. The two on the left are multi-use. They can be cleaned and reused. Protective gloves. Put on before physical contact with every patient. If I see you doing your ride time, and if I catch you without gloves, I will send you home and you will have to redo that shift. Gloves are an absolute necessity for every patient. Check the condition of gloves before putting them on. Change gloves between contact with different patients. Never reuse gloves, and discard in clearly labeled biohazard containers. This is the proper technique for removing gloves. This is to ensure that you don't get any pathogens on your skin. You can see how you're taking it off with the one glove, and let's see if it goes into the next. You're balling it up. Sorry. What you're going to do is you're going to take that remainder of that glove that's in the left hand and put it in the right hand. And then you're going to take two fingers from your left, slide it underneath your glove, and then slide that other glove off just like you did with the other one.